Hello, my name is James Hartsfield, and this is my neurological and musculoskeletal assessment. Quick scan of the room. And I will be facing away from this computer, so I will not be using it for anything. Okay, so the initial assessment begins when the patient walks in the room. I will be observing the gait. I will then begin. Also, this pencil will be serving as pretty much everything I need, including any pin light, any hammer, any tuning fork, anything like that, since I don't have the equipment with me. Alright, so the assessment begins by inspection. Initially, I just look for any sort of asymmetry. In an actual clinical setting, the patient would either be topless or in a gown, so I'd also be looking for any nodules, any areas of inflammation, any sort of growth, anything that is not within the normal limits for a musculoskeletal system. I begin with palpation. Afterwards, initially I'm just going to palpate starting at the cervical spine and working my way down in a back to front manner. Again, looking for any sort of asymmetry, any nodules, any areas of pain that the patient might note, any bulges, any signs of injury at all. All right. Next, we'll begin by, I'm going to work in a systemic fashion, working my way up from the hands, up to the elbows, the shoulders, the spine, and then down to the lower extremities. As I go through the range of motion, I will also be looking at testing strength as well. So initially, can you please hold your hands out for me like this? Yep. All right, make a fist for me. And release it. Spread your fingers as far as you can. Close them together. Place your hands like this. Put your thumbs like this. All right. Put your hands back like this. Extend up and down. And can you rotate them side to side? Thank you. And I'm looking again for any asymmetry, any audible crepitus, any pain that the patient may have, any difficulty moving, any nodules or bulges that's here. Now, please lift against my hands. Thank you. Place your hands like this. Push. And push against your hands. Thank you. All right. Working my way up. I'll be palpating along the bone processes of the forearm. Again, in a more targeted area, looking for any sort of abnormalities. All right, please flex your hands as far as you can go. I'll test passive range to make sure you can't go any further. All right, up your hands. I'm looking for elbow extension out to either 0 or up to 15 degrees. All right, put your hands up one more time. And rotate your hands like this. Yep. Moving up to the shoulders, I've already palpated the shoulders for any sort of abnormalities. All right, please raise your hands above your head as high as they can go. Thank you. And lower them. Now raise them up in front of you. All right, and bring them back. Bring them behind you. Thank you. And now bring them out to your side. Thank you. And lower them. All right. And now I'm going to test. Please raise your hands again. Them and move to the side, up them and to the back. Thank you. Right. And bend slightly at the waist for me, and then bring your hands out to your side like this. Thank you. I'm looking for any sort of abnormalities or any differentiation in the scapula area, any sort of dislocation, anything of that nature. Right. Please lower your hands. Thank you. All right. Moving up to the spine, starting at the cervical spine area. Moving down into the T1 region, looking for any abnormalities. All right, bend your head forward for me. Now push against my hand. All right, now look up towards the ceiling and push your neck forward for me as far as you can. Thank you. All right, push against my hand. Thank you. Push against my hand. Thank you. And push against my hand. Thank you very much. Testing for any strength issues. Again, any pain, any crepitus. Step forward for me slightly. moving down to the thoracic and the lumbar spine area. Again, I've already palpated. No abnormalities detected, no irregularities, no areas of swelling or pain. All right, please bend over, touch your toes as far as you can. Thank you. Back up. All right, bend back and look up at the ceiling for me, bending at your waist as far as you can go. Thank you. All right, bending at your right hip. Lean towards me. Thank you. And then lean the other way. Thank you. And now rotate from side to side. Thank you. Right. Now, moving down the hips, I've already started to somewhat assess the hips, just from that movement. But again, palpate and percuss for any areas of tenderness or pain. Turn this way. Pressing. Turn back. All right, I'm going to have you lay down so I can test your hip movement. All right, first the patient will lay supine. Please keep your legs straight and extend it up as far as you can go. Thank you. Same time, we'll do both legs at the same time. Now for this one, please roll on your stomach. In the prone position, please raise both legs as far as you can. Just at the hips. Thank you. All right. Now, roll back supine. Thank you. Now, bring this leg over across this knee as much as you can, bending on the inside. You're going to move for about a 40-degree angle. And then the same with this one. Thank you. And now, make basically a triangle with your leg, placing this leg over this knee. Thank you. I'm looking for about a 45-degree angle here. Now repeat with the other one. Thank you very much. And now, please raise your leg up as much as you can, testing strength. Then, one more time, roll on your stomach, please. And raise your leg. Thank you. And raise your leg. Thank you. All right, you can stand back up. All right. And now, actually, I'm going to have you sit down for this so we can actually see your knees. We're going to be testing both the front, the anterior, and the posterior aspect of the knees. Feeling for the natural grooves, any swelling, any possible edema that may be present. Also, again, any pain. Right, please stand up. Now, keeping your knee straight, extend your leg as far as you can.
Like,
yes, lift it. Yeah, lift it forward. Yep. Thank you. Bring it back. And now the other one. Thank you. Bring it back. All right. Now sit back here. Now we're going to look at the feet. Again. Begin, after inspection is already done, begin with palpation of the Achilles tendon and down into each joint of the toe, from proximal to distal. Curl your toes for me as much as you can. Now extend them as much as you can. All right, now bring your feet in, like your pigeon toed. Let's now roll them outwards the other way. Right, now bring your feet up. Press for me. Here's my hands. Thank you. And now lift them up. Thank you. While I'm here, even though this next part is part of the neurological assessment, I'm going to go ahead, hold the foot, now flex as much as you can, testing for clonus of both ankles. Thank you. Also, I don't think I actually verbalized it, but I will say in the hand assessment, I would do the same thing with the joints, the moving along the metacarpals from proximal to distal, testing each joint for any nodules, pain, swelling, inflammation, any signs of abnormality. All right, moving on to the neurological assessment, I'll begin with testing the cranial nerves. The first cranial nerve that we tested will be olfactory. For this, the patient would simply inhale in separating between the two different nares, different scents, starting with the weaker scents first and then moving to the stronger scents. Cranial nerve 2 would be tested in a vision test with a Snellen chart, as well as a pen light, which would have been done on the eyes and ears assessment. For cranial nerves 3, 4, and 6, I'll simply have him follow my pen, testing the 6 cardinal fields of vision. Of accommodation. For the trigeminal nerve, please pinch your jaw. I'll tap bilateral sides and stroke. Now, move your jaw from side to side and protrude your jaw forward as much as you can. And now bring it back in. Right. For the facial nerves, I'm going to give the patient several instructions about facial expressions to make. Please wrinkle your brow form as much as you can. Now raise your eyebrows up. Puff out your cheeks. Now purse your lips. You're blowing air. Now show me your teeth like you're smiling. And then clench your eyes shut. Thank you. Cranial nerve 8 would be tested with a tuning fork. It would be the same as during a hearing test. You would do the Ryan and Weber test to test sensory loss as well as conduction loss on the top of the head and bilaterally. For cranial nerves 9 and 10, the first thing I will do, and for this I will stimulate it, would test, please open your mouth. I would test the gag reflex. I would also have the patient please swallow, as if they're swallowing water. I would also be listening to the patient's speech from the minute the assessment began to hear any guttural sounds, hoarseness, difficulty speaking. For the spinal accessory nerve, I already tested that during the shoulders. Please raise your shoulders up, shrugging them. I would test the strength of the shrug. And for the hypoglossal, please stick your tongue out, move from side to side, testing the tongue. Next, I'm going to test just coordination. Please raise your hands up. Now, starting slow, touch each thumb, your thumb to each finger and back. We'll keep doing that and go faster each time. Very good. Looking for any bilateral asymmetry and difficulty as the speed progresses. Please close your eyes. Extend your arms out as far as you can to your sides. To your side. Raise your thumb. All right. Now, alternating between your fingers, please bring your hands in and touch your nose. Other, and keep doing it and increase speed each time. And looking for bilateral asymmetry and difficulty as speed increases. All right, stop. All right. I'm now going to assess for sensory issues. Begin by stroking the patient in various areas. Please close your eyes. And let me know when you can feel this. Feel it. Feel it. I feel that. Feel that. And also slight pain. Please let me know you feel this. Feel it. Feel that. Moving in a no discernible pattern. I feel that. Alright, please keep your eyes closed. I am going to hand you an object. I want you to tell me what object it is.
The one kept in.
Okay. I'm now going to draw an imaginary number on your arm. Please tell me what number I draw.
6.
And on the other arm.
One more time. 7.
I'm now going to do, test 2 point, discern to different 2 points. All right. Please let me know when you feel my fingers.
I feel it. Now I feel 2. I feel it. Now I feel 2. Feel it. Now I feel 2.
And again, on the fingers, the space should be much less than on the back as far as the discerning goes. All right. Lastly, again, I've already checked gait. I checked gait as soon as the patient walked in, looking for any sort of wobble, staggering, leading with any foot, any sort of imbalance in their step. And finally, I'm going to test reflexes. Again, this is going to simulate my hammer. All right. For the biceps, have the patient flex their arm at 45 degrees. I will strike my hand, which in a real setting, this would elicit a response from the patient. I will then strike the anterior inner forearm. I will have the patient flex their arm, hold their arm, strike the tricep. strike patellar joint, testing the knee, and lastly, the ankles, and I already checked for clumps. Again, looking for any, I would also have the patient lay down one more time, and to test the abdominal reflexes, starting at the umbilicus, stroke up and away for the upper quadrant reflexes, and down and away from the umbilicus for the lower quadrant reflexes. I'd also check the cremaster reflexes by stroking since he is a male, stroking his inner thigh, which should cause a raising of the testicles. Again, these reflexes should respond very quickly, as they are deep tendon reflexes, and there should not be any sort of shaking, there shouldn't be any delay, they should also not be hyperreactive. This concludes the musculoskeletal and neurological assessment for this patient.